we are calling the patients during the normal cycle, first of all. Just after the ovulation to see her uterus and how the uterus responds to her ovulation or something like this, okay? And we have to evaluate without any hormonal effect the uterus of the patient with the ultrasound, first of all. And secondly, if we see any problem, any distortion on the uterine lining, or if there is any mass like fibroid, or if she had any liquid inside, in this case, we have to evaluate the uterus and the tubes before the embryo transfer, before to start to prepare the patient. And the traditional thing, traditional exam in this case is the HSG film, hysterosalpingography. This is a radiological exam. We put on the table the patients on the gynecological position, and we put a catheter inside of the uterus, and we give a radio opaque liquid, and we start to take some pictures with the radiological machine. And with this, this liquid fulfill the uterus, inside of the uterus, and like this we see if there is something wrong, like polyp or any myoma or any adhesion, any congenital problems in the inside of the uterus. And secondly, we keep giving this liquid, and liquid from the uterine cavity goes through the tubes, and like this we can see if the tubes are opened or are obstructed. Okay, and according to the findings, sometimes needs some surgery before the embryo transfer, like hysteroscopy or laparoscopy. And like this, we prepare the patients for the embryo transfer before to start the medications. Okay, this is very important. And I mean, first of all, you have to, as a gynecologist, you have to evaluate the patient's uterus during the normal life. Okay, if you don't see any problem, or if in the medical history of the patients there's no suspicious things like too many abortion, like any uterus surgery, something like this, in this case you can start. Most of the time the patients, when during the preparation, they can give the right answer. How we evaluate this? Okay, as I said before, we started to the preparation on the second day of the menstruation, and it takes 13 days with the medications. Okay, 13 days after after to start the medications, we call the patient back, and first of all we do the ultrasound. In the ultrasound, two things are important. The endometrial lining shape, that we are calling tree line, is the best picture. And otherwise, the second thing is the endometrial thickness. And traditionally, it must be more than 7 millimeters. Okay, and if you see good shape and a thickening more than 7 millimeters, it means that she's ready. And this is the two objective criteria for us. Okay, and most of the time, if the patients who had surgeries, some adhesions, some infections before, and they might have problem in this thickening of the uterus, even with the medications, vaginal medications, or even with the surgery. In this case, according to the ultrasound findings, sometimes we let the patients to go until the transfer. Otherwise, if the ultrasound result is not satisfying, in this case, we stop medications, we go back, we see the patient's file. If needed, we repeat all tests like film, like hysteroscopy, laparoscopy, and then to restart.